Hi, welcome everyone to our Cecilia Health Blood Sugar Boot Camp, the ins and outs of testing your blood sugars. I'm Emily. I'm one of the dietitian diabetes educators here with Cecilia Health. And one of our pharmacists, Elise, will be presenting tonight. So welcome. Here at the bottom is a phone number, 1-800-263-6317. If for any reason you're having any technical difficulties, you can always reach out to that as well. So, Elise, could you have us move to the next slide, please? I forgot to ask you to do that tonight. Thank you. So this is an interactive program, and the idea is that we're going to have a short presentation, but there is a time at the end to have some discussion, some Q&A. You will see over here on the right-hand side on your toolbar, there is a questions tab where Elise and myself can see if you want to enter any questions in for Elise to answer to the group. That will be your chance to get to do that. And also as a disclaimer as well, here we go. As a disclaimer, next slide please, Elise, I'm sorry. Thank you. So as a disclaimer, we know that the information you are about to hear may motivate you to make some changes, but please do talk to your doctor before making any changes to your current routine. This online Q&A is intended to give general advice. The information is not a substitute for personal medical advice. It involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. So thank you again, everyone, for joining us tonight. And so for tonight, our webinar leader is, like I said, Elisa Swinson. She is a registered pharmacist with a master's degree in patient education and a certified diabetes care and education specialist. She has over 40 years of experience working with children and adults with diabetes. She lives in Salt Lake City, Utah, and she volunteers for the local Children's Diabetes Camp Foundation. And in her free time, she enjoys family history, research, quilting, reading, and traveling as well. So a warm welcome for Elise tonight. We're so excited to have you here. So thank you, everyone.
Well, thank you everyone for joining the webinar. I know you care about your health or you wouldn't be here. And checking your blood sugars, I'm sure that the first thing your doctor looks at and says, oh, how is your blood sugars doing? Or when you talk to your diabetes educator, they say, oh, how are your blood sugars doing? And we all kind of go, oh, you mean my hamburger fingers from having to poke them, and my sore fingers? And so checking blood sugars it's a challenge, and it gets old and it's hard to do. So I'm just going to go kind of through the agenda and give you some tips and things that maybe will make it a little bit easier, or maybe give you a little bit deeper understanding of kind of why, everyone gets so focused in on blood sugars. So we're going to do why we do it. That's always the big question. We're told a lot of things, and especially as a pharmacist, we always tell people just take your medicine. And sometimes we're not even sure of why we're taking the medicine, or how is it going to benefit us. And it's kind of the same thing for blood sugars. I get a number, but what does it mean? And we're going to talk about how to check your blood sugars and when, and how to keep a log. Fortunately, now we have a number of options on how to keep track of that. Now, we're going to talk a little bit about target ranges and managing high and lows. And we'll talk a lot, when we talk about that, just always keep in mind that every provider, every doctor is a little bit different, and every patient is different. And so your target range may not be the same as someone else's. So we're just going to give you, just kind of some guidelines. And then we're going to talk about something called the dawn phenomenon. And that's not necessarily just for people with diabetes, but it also happens with everyone without diabetes. And I'm sure Emily will tell me when I start talking too fast, because that's one of my problems. I do talk a little bit too fast, so I apologize in advance. So we're going to talk a little bit about ketoacidosis and checking for ketones, and what does that mean and why is that important? And then two big numbers that we talk about is the A1C and the EAG. And that just stands for hemoglobin A1C and estimated. hemoglobin A1C. And we'll talk a little bit more about that and why we really look at those numbers and what those numbers mean. And then, like Emily said, we'll have some time for some questions and answers and sharing. So please feel free to type in anything, any questions you have, or just type in and say, Lee, slow down. That's good too. Why should you check your blood sugar? What does that, why does that, is it important? It's kind of like we talk about medicines and we talk about all the tools to help us now with diabetes. And this is just one of those tools. Just as there are many different kinds of medicines and everyone does different to help with diabetes, so is checking your blood sugars. It's just another tool. It's your meter and it's for you. It helps the doctors give you some guidelines, and are you on the right medicine? And a lot of that is when you're testing your blood sugar helps the doctor determine that. And we'll talk a little bit more about that in a minute. Most providers will look at your data, and the different ones can do different things. Some want you to write it down. Some have the software where they have you bring your meter and you can plug it in and they can download it, which makes it, kind of easy. Some people, sometimes you call the doctor and the diabetes educator may have you read off your numbers just as a virtual visit. And then some of the real advanced, will actually, with the continuous blood glucose monitors, which we'll just touch on, can actually give us a lot more information. And that the doctors can look at that virtually. But the biggest thing is knowing your blood sugar helps you to know where you are. Am I feeling kind of funny? Is it my blood sugar too high? Is my blood sugar being too low? I feel fine, but my doctor is telling me my A1C is high and my blood sugars are high, but I don't feel it. And so checking your blood sugar is just a number. And it's just something to give you some guidelines. It's kind of why is it important? It gives you a picture of how you respond to your diabetes care plan, how you respond to different foods, especially things like pizza, pasta, certain things the body has different responses to. Definitely as they're absorbed in the body, they affect the blood glucose or the blood sugars. And you're going to be affected a little bit differently than your neighbor or the next guy. And so by knowing your particular own blood sugar, that helps you make some decisions later or can help you kind of adjust things and maybe not eat 3 pieces of pizza, but 2 pieces of pizza, or, wonder why, 6 hours later, your blood sugar is high again. Understanding how your body responds to different foods or exercise is important. One of the things we'll talk about briefly is that if you keep your blood sugar in your target range, it may prevent or delay complications. Some of the really good studies now are showing that. And I have a little chart that will show you that kind of helps estimate that. Everyone's different. Some people develop complications early, some people later. But the key is that if you keep your blood sugar in range and know where it is, then you may delay or prevent. And just to know that your blood sugar is not going to stay the same all day long. Even if you're not eating, even if you're not exercising, just doing your normal daily activities, it's going to go up and down throughout the day. And then, it finds out, when is it? Is my blood sugar always going up after lunch when I test my blood? And just before dinner, I'm always high. Do I have high blood sugars first thing in the morning, but I'm okay throughout the rest of the day? And those types of information really help the doctors and the providers kind of manage your diabetes. There's different medications, there's different treatments that where your blood sugar is they can tailor make it to do that. We have so many different tools now to help keep that number where we need it to be. You know, there's a times when it's really important that you need to monitor. You know, some doctors, if you're pretty stable, will say just a couple of times during the week, you know, take your morning blood sugar, or take your blood sugars after you eat, especially, you know, it just may be something that that particular provider likes, you know, their patients to do, because it helps them tailor make, you know, a really individualized treatment program for you. But it's really important to monitor regularly if you are on insulin. Even if you're just taking the once a day long acting insulins like Tresiba or Lantus or Toujeo, it's really important to monitor your blood sugars. And especially if you, in addition to that kind of insulin, if you're taking the fast acting insulin, like if you're taking insulin before meals, or if it shows you have a high blood sugar, then we really need to keep track of that we're not going too high or too low. And if you're just having one of those times in your life where no matter what you're doing, your blood sugars are just not behaving, and sometimes they just don't behave. It can be just unknown. It could be changes in your life. It can be changes in your weight. It can be changes in your diet. It can be stress. It can be a lot of different things. And sometimes, no matter what you're doing, your blood sugars are just not where you want them to be. One of the really, though, important times to monitor regularly, if you are having low blood sugars, and if you're not, is called, you're not recognizing those signs. You don't get the shaking, or you don't feel different, but you all of a sudden you just have a real low blood sugar and you can't function, and not being able to recognize the early warning signs, then it's really important to monitor your blood sugars. And by the same token, if you're sick and you've been running some high blood sugar levels for a while and have something called ketones, which we'll talk about, then we need to have a lot of information in terms of why your blood sugar is going up, how high it is. And that really will determine the treatment, especially when you contact your provider. One of the ways, how do we check our blood sugars? You know, one of the big things is to wash your hands before testing. One of the questions we really get asked a lot is, should I use alcohol? If you use alcohol, it does make the skin a little bit tougher, and you need to make sure that it's dry. But again, you know, if you're not in a position where you can actually wash your hands, the same thing with hand sanitizers, you know, make sure you've rubbed it in, and so that you're testing, you know, as the little lancet goes through the skin, you're going to get the blood, not the hand sanitizer or the alcohol. So that's just something to be important. Some providers, and you can ask your own educator, your doctor, will maybe have you get a little drop of blood and wipe it off, and then get another drop of blood. And that's just kind of specific to a provider or your educator. So just make sure that we're testing blood and not, or as I tell the kids, we're not testing the food on your hand with the dirt. We want to test blood. And then we put in the test strip. And sometimes when you're having, you know, that sounds like really simple, but sometimes if you're having a low blood sugar and you're shaky, it's tough to get that strip out of the bottle and into the meter. It's tough, you know, and then so that sounds really simple, but you know, sometimes it's kind of tough to do, especially if you're shaky too. And then just touch and hold the strip. And I call them a sucker. Most strips are the suckers. You just kind of have to hold it up against, and it'll suck in what it needs to be. And most are 5-second meters. Some are a little bit longer. Some of you may have talking meters, and they do take a little bit longer. One of the things is and then you just kind of wait to see what the blood sugar says. One of the things to do is sometimes if that's not making sense, your blood meter should come with some what's called control solution. And one of the things you can use is and that just will let you know if the strip is good. So you just put a drop of that instead of blood on the strip and put on, and then the meter will read that and it'll let you know if the strips are still good. And that's something I encourage you to ask your pharmacist about and have them show you that, because that really helps, especially how expensive strips can be, and sometimes you need to do that. So make sure, or you question, did they get too hot or too cold, or because they weren't stored, one of those things, you left your meter in the car, which I'm sure never happens to anybody. Or you left it someplace and all of a sudden you found it, type thing. We want you to test. When do you test? For different people, it's different things. Most doctors or most providers would like you in the morning before your breakfast, or just before a meal, and at least 4 hours after a meal, and they consider that kind of fasting. Or the other time to test is 2 hours after the start of the meal. And that's a word called postprandial, which just means after meals. And you'll see that PP sometimes, the doctors will write that. And they want to just see how well your body responds to a meal. Do they need to give you a medicine that kind of helps you your body respond to as the sugars and the carbohydrates are broken down? Do they need to adjust your medicine? And that's why that's really kind of an important time to test your meals. Fasting is just to see how overnight and how your body is adjusting over time. And again, that it depends on what your provider is looking for, what you're looking for too, and how often you can do that. One of the things is, especially as we get into the winter, is to, when you're washing your hands, use the hot water, use our warm water. That opens up those little capillaries. One of the nice things about blood meters now is that they don't take a lot of blood. One of the questions we ask, and it's more common, is that people say, well, how about milking? It's not a good idea, milking. Yes, you can squeeze the arm and the palm of the hand to kind of move the blood into the fingers, or use gravity. After you wash your hands, hold them down, and that'll get some gravity to pull some of the blood into those capillaries. But try not to squeeze the finger very hard. And then where do you test? We hear about there's different places to test. One of the things I like to teach is if you put your hands together, and not on video, but if you could see, I'm putting all my fingers right together, so my palms, or my pads of my fingers, are touching. And if you poke where the fingers are not touching, so kind of to the sides, because that's where you get a lot of good blood flow and less nerves. And then you're not going through the calluses on the pads of your fingers. Some alternate testing sites, some people can use the palm of the hand. Just make sure it's clean. And this is for routine testing, but if you're having a question, if you're having a high blood sugar or a low blood sugar, you always need to use your fingertips, because that's more real time versus some of the alternate sites. But those are kind of options, especially if you're testing a lot and it's just routine and your fingers are sore, and to do that. And also rotate those fingers. I'm sure we have mostly adults, but kids, they have the one finger they like using, and really have a hard time doing other fingers. So rotate those as you can too. The target ranges, again, that really depends on your doctor. But for the most part, the American Diabetes Association say, sometimes you're fasting before meals, anywhere from 70 to 130. Some of your doctors, if you're on insulin, they may have that a little bit different. If you don't recognize when you're having low blood sugars, they may have that a little bit higher. Sometimes if you're a senior like me, they may want it, may have that lower number, that 70, a little bit higher. So that's something you can talk to your doctor about. But as a general rule, 70 to 130. After 2 hours after beginning the meal, this postprandial, they do want that less than 180. So one of the things is, oh, it's not been 2 hours, but I'm testing an hour after. Oh my gosh, I'm 200. We'll wait and see if you are coming down, because we want to see if your body's responding, and not just react to the number. Here are some general recommendations that they have. Most now, the ADA is saying an A1C of 7 or less. Some doctors say 7.5, some say 8. Again, check with your provider. And like I said, it depends on you. All of these other things that they may want to be a little bit more aggressive and have tighter targets. Again, they may have a little bit more freedom, a little bit more liberal because of your age or other medical conditions. And sometimes it's just, it's up to you, and you may be different because you've been running in the 200s or the 300s, and now you're looking to come down, and so you're trying to get more in the target range, and so everything is different, and everything is a stepwise. Everything isn't going to be miraculously well overnight, but we can speed things up and get where we need to be. One of the things I always want to say is a blood sugar is just a number. A number is non-judgmental. Numbers don't have feelings. Numbers are not good or not bad. They're just a number. And some people get really nervous or anxious about testing their blood or going to the doctor to get their blood tested because they don't know what that number is, and that it's not a judgment. If your number is high, and if your A1C, which we'll talk about right now, meaning your average blood glucose over 2 to 3 months is higher than you would think, that's a starting point. Always remember, the number is a starting point. Do we want to keep where we are because we've got an A1C of 7? We've got our blood sugars are showing us a fasting of 100 every morning. Our after meals are showing us 120. Do we want to stay where we are, or do we want to make a change? It's the starting point. We're starting to see a little bit over time where there are a little bit better measurements of things that over time that gives us a little bit better picture of where we are. And that's the A1C. Red blood, what this measures is the amount of glucose or blood sugar attached to a red blood cell. So a red blood cell has an average life of about 3 months. So what this test measures is how much sugar is attached and what percent to that red blood cell. And they come up with this number. So it's actually a percentage. And it's also just something that helps us know where we are doing. Do we need to change up our medicines? Do we maybe need to get a little bit more exercise? How about those couple of pounds that maybe we need to do? How about the weather being so terrible that I haven't got out to exercise or feel like walking? It's all of these things play together. And it also is just something, like I said, a starting point. It's a goal we want to maybe shoot for, but it's where we are right now and what do we need to do or anything. Here's where we kind of measure that, so you can see the E is kind of where, if that was your blood sugar. So if you averaged a blood sugar of 154, your A1C would be about a 7. So think about your fasting blood sugars and think about your after meal blood sugars. And if they're kind of in that range, you're going to be about a 7. And that's great because that's what ADA says, okay, I'm doing okay. I'm where I need to be in terms of maybe preventing and delaying some complications. And also always remember how you are feeling too. I feel good. I feel better. I didn't realize when my blood sugars were in the 200s that I didn't feel very good. Now I know what feeling good is like. You can see that they actually are changing. When do you get diagnosed for prediabetes? Over time, that keeps dropping with this A1C. So you can see that, again, where the complications start increasing, where we want to see the A1C. And again, that's target is dependent on you, what's going on with you. But you win the diagnosis of diabetes, if you are greater than 6.5. But, when you get into this pre-diabetes, the 5.7 to 6.5, that's when you start looking at maybe lifestyle changes. Some providers will start you on meds, but they'll want you to maybe test your blood sugars and see, is your changing up your exercise routine? Is it maybe looking at what you're eating and how you're eating? Maybe losing those few pounds. What are you doing? Is that effective? And that's prediabetes. So that's just kind of a guideline for that. Hypoglycemia and hyperglycemias, fancy words for low blood sugar and high blood sugar. You can get low blood sugars, that eating too, maybe not enough food. If you're on insulin, you thought, oh, maybe I'm going to eat a little bit more than I thought, and I didn't. So I had a little bit too much insulin in the body. The shakiness, the sweating, the weakness, the rapid heartbeat, things like that. And just you feel like you want to eat everything in sight. Really, I see that with the kids, you just are so hungry because you just want to get the sugar up. But, one of the treatments is, so you don't really want to get yourself too high or you're kind of what we call yo-yoing. So right now, for most adults, the rule of 15, it's 15 or 20 grams of a fast-acting carb. Well, what's a fast-acting carb is the question. And things like Skittles, that's crazy, but that's good. I always kind of recommend now glucose tablets. You get a bottle from your pharmacy, and they're good because the minute you start chewing those, you're absorbing it. If you're drinking apple juice or having Skittles or whatever you use, cake frosting that people sometimes use, they need to go in the stomach and have to be absorbed. Whereas glucose tabs, you can get things very quickly. It's still going to take a few minutes for it to come back. And that's a long 15 minutes. And that's where you're needed to kind of be a little bit patient and not overeat or overtreat. Like a bag of fruit snacks too. That's kind of important. So just waiting, and then if you're not coming up, and then you need to check, and this time you really need to use your fingertips because that's the most accurate or real time. And also just kind of remembering 1 gram of carbohydrate will raise your blood sugar about 5 points for most adults. So, that's kind of another rule, if you're into the number games. If not, it's just 1 serving of rapid acting carbs. Hyperglycemia, just not enough insulin. It's just not working properly. Some people, the cause is stress. Stress definitely acts on it. And maybe too many carbohydrates. Some people start getting higher blood sugars as a precursor or the first warning signal of being sick. And, you know, everything else is just fine. You're just having some high blood sugars. Again, things could be that you just didn't exercise, and stress, sickness, maybe a little bit too high of carbs, or just something with the diabetes medication. But it's really important that diabetes is always changing, you know, and your body's changing. Some of those cells are wearing out. You know, they may be doing okay and giving you some insulin, but over time, it just all may change. Ketoacidosis and checking for ketones. It's the body is reacting because there's not enough carbohydrates or enough sugar getting into the cells for fuel. So you have high blood sugars, but the sugar can't get into the cells. So the body starts breaking down fats. The body does not like ketones, and the brain doesn't like them, and it's waste products. And the body tries to get rid of the ketones through urine, but eventually there's just too much, and the urine can't keep up, and so they build up in the blood. There's the whole issue about Atkins diet, and that's a subject of another webinar. But we really want to avoid ketones. The body doesn't like it. It's means you're breaking down fat, and you may have high blood sugars, but you're just not getting enough sugar into the cells. And it can be serious. It's blood sugars that are over 300. Sometimes some providers say over 250. You're sick, you're throwing up, your headache, you're tired, thirsty. Your brain is really confused. There are two ways to do it. The ketone strips, which is the urine, is not necessarily as accurate because it's not what's going on in the blood. It's the ketones are being excreted by the urine. There are some ketone meters, and those of you that see an endocrinologist or a specialist in diabetes, ask them for a sample ketone meter so that you have those, because you want to measure those trends. And that's going to be a little bit more real time for you. And you use a blood ketone meter just the same as you would a blood meter. It just will tell you what your ketones are. And that gives your provider a lot of good information too. The dawn phenomenon, everybody has that. It's called the wake up hormones. The body gets ready for the day and it says, okay, I'm ready to wake up. Here's some cortisone, here's some cortisol. And the blood sugars go up. If you don't have diabetes, your body will respond and they will take care of it. However, people with diabetes, sometimes their bodies don't adjust that for it, and they do have high blood sugars in the morning. There are some steps that you can use to maybe help eliminate that, but it's also something that you want to talk with your doctor about, and it's with the long-acting medicines and the long-acting insulins and things like that. You know, sometimes those need to be adjusted. But here's some good tips too if you're starting to see that. You know, eat a little bit earlier. Make sure you have a protein. If you do get hungry in the night, you know, more protein, less carbs, something active, and then make sure, you know, you're letting the provider know. These things that we talked about, they can cause you to have lower blood sugar, missing meals, alcohol intake, especially on an empty stomach. And that's really something you want to make sure that you definitely have something on your stomach while if you're taking a couple of drinks. A little bit more exercise than usual. And if you're losing weight, as you become more physically fit, your cells are much more responsive to the different insulins or to the different medicines that allow the insulin and the insulin to let the sugar go into your cells. So make sure that if you're routinely going below 70 or below your target, you really need to talk with your doctor because it sounds like some adjustments may be needing to be made. And then we talked about how to treat it. And here's some good ideas for that. Gummy bears, lifesavers, Skittles, anything like that. Again, my fave is the glucose tabs because they're 4 grams per tablet, and you can be doing that too. And just to be sure you wait, so you're not going too high and then you're kind of chasing after blood sugars all day long. Keeping a log, your doctors, some like it this way, a handwritten log. There's a lot of good phone apps. Like I said, you can take your meter to the doctors and most can download those. So talk with your doctor and how you want to do that. Some people are not comfortable with the smartphone apps, but here's a couple of those that are really, really good. Diabetic Connect, My Sugar is good. Any of those is that where you could maybe tag and say, oh, I need to be watching that. But good old pen and pencil also works really, really well. And as long as you know, is it a fasting? Is it an after meals? You know, and if something's odd, write in the comments, oh, I exercised a lot today, or I had Olive Garden and I ate every single thing in front of me. You know, just something so that the doctor has some information. You know, let your doctor know. Just like I said, this is a number. It's a starting number. You know, oh crap, look what happened. Oh great, look, I'm much better than I thought. I'm seeing that every morning I'm running high, doc. You know, what's going on? I'm always high after lunch. You know, where am I? You know, these are the things, and especially lows. If you're having low blood sugars, that's something that your provider needs to know sooner than later. Maybe not at your 3-month visit, but maybe if you're starting, you know, that's something you really want to jump on. I see that I've already gone over time. There is a couple of case studies, and basically that's kind of how you can look at, and just to help identify how many highs are you having, how many lows are you having, and when they are occurring. You know, and just having something like this really helps the doctor decide what to do. Can we fix them without changing the medication, or do we need to change the medication? So versus the actual, you know, so this is how the doctors can use the blood sugar log. They'll look at what happened that morning and they'll look back the night before to see where you were. The same, see a lot after breakfast. You know, obviously something needs to happen. Maybe how much medicine, or if she's on insulin, how much more insulin does she need to take before breakfast? Same thing, but as it goes down, is it okay? So, you know, these are the types of things that the doctors like to see. If the providers can see different times of the day when you're testing in relation to meals, that's really, really helpful. And the same here, you know, at some point, you know, with these high blood sugars looking 249 on that, maybe this is something that they need to really take a hard look at. Is it the insulin? Is it the oral medication? Are neither one of those working? Do they need to change them up? You know, what do we need to fine tune? So these are where the logs are very, very helpful. So basically, in summary, it's the A1C provides a big picture over 3 months. It's a number. It's not a judgment. It's to let you know where you are. It's also to let the doctor, the provider know how well they're doing their job and helping you manage your diabetes. Blood sugars are just one moment in time. So checking at different times and different circumstances will really help, you know, you fine tune what you want. And it's you, it's your power, it's in your hands. And the more you know, the more you can have a say and know and identify what works specifically for you. Thank you very much. I know I talk too fast, but I thank you for your attention, and I'll just turn this back to Emily.
Right. Wonderful. Thank you so much, Elise. Thanks for going into all the different topics about blood sugars. As everyone can see, there's a lot to talk about, and that's why we all love what we do in terms of being a diabetes educator. But like I said, you all got an extra treat with being able to hear from a pharmacist tonight, as well as really exciting. If you think of extra questions, please bring those up with your health coach, with your diabetes educator, with your doctor, and we want to answer your questions that you're having as well. And Elise, if you'll go to the last slide here, there's one more. These are our webinars that we have coming up. Here next month is A Healthy Heart is a Happy Heart. We also have in October a great just laying the groundwork about Diabetes 101. As always, you can check out our Facebook page. Please do talk to your diabetes coach if you have more questions about what Cecilia Health has as well. But thank you all again for joining us, and have a great rest of your day. Thank you. Bye-bye.